patient is cutting and loading firewood. Some discomfort started in his chest, felt like heartburn about 30 minutes ago. He took some Tums, he sat down to have a rest and some water. The pain did not resolve, so he decided to go ahead and load the rest of the wood and head home. However, the pain increased and he is now feeling nauseous and is afraid to drive himself home. Your patient is sitting in his pickup holding a clenched fist to his chest. Alright, we're dispatching you to a county road 6 miles outside of town in a field. Sunny fall day, 66 degrees, 1,500 hours, dispatched out to such and such Oak Road for a 46-year-old male with chest pain. The caller says he is in the field north of the farmhouse in a red pickup.
Alright, I got my proper PPE on. Is my scene safe?
Yes, your scene is safe. Dirt road allows you to drive the ambulance to the patient at the edge of the timber.
Alright, there's only one patient.
Correct.
Alright, chest pain I'm going to go ahead and call for ALS. I'm not going to consider C-spine and my general mechanism of injury is chest pain.
Yep.
Okay. And then general impression, he has chest pain, level of consciousness. How are you doing today, sir?
I just was out cutting wood, had some chest pain there, sat down, felt fine, said screw it. Got my pickup, drove home, and then I was like, shit, it hurts. Got worse, so I pulled over. And I called you guys.
Alright. Level of consciousness is good.
Yep. Patient is alert and oriented.
Alright, and the chief complaint is the
My chest hurts. I'm pretty sure it is heartburn, but it is making me sick or feel sick to my stomach.
Alright. Go over his airway. He's talking to me, so he's breathing. His breathing as his chest rise or his chest rise.
It's equal to chest rise.
Alright. Can I go ahead and listen to your lung sounds?
Sure.
Big breath. Another breath. How are his lung sounds?
Lungs are clear bilateral.
Okay. Alright. So, for check circulation, check his pulse.
His pulse is strong, normal, normal radial pulse.
And skin.
His skin is pink, cool, and sweating profusely.
Okay. And then is there any other bleeding?
Nope, there is no bleeding noted.
Okay. And what's his SpO2?
His SpO2 is 95%.
Okay. And then I don't believe we need to treat for shock. I feel with this chest pain, I feel it's a high priority patient. Need to get him going. So we'll go ahead and get going on that. Let's go with when did this start, the onset?
I was loading wood in a trailer. When the heartburn started, I took some Tums, but it did not help.
Okay. And then provocation.
Nothing makes it better, but getting up makes it worse, or seems to make it worse.
Okay. The quality of the pain.
It's just a dull but intense pain right in the middle of my chest, kind of like an elephant is sitting on my chest, Kind of makes me feel like I can't catch my breath.
Okay. Does it radiate anywhere? Is it right in the center of your chest? Or?
It doesn't go anywhere, it just stays in my chest.
Okay. Severity, a scale 1 to 10.
It is a 7 out of 10.
Okay. When did it start?
Started about 30 to 40 minutes ago, but this happens from time to time, so I'm not worried. But the tongue sometimes helps, but not this time. I tried to finish loading my truck and go home, but I got nauseous and kind of short of breath, so I didn't want to risk driving home and passing out.
Okay. Well, signs and symptoms. He's obviously having chest pain. Allergies.
No allergies.
Okay. And then medications.
Medication takes Tums and ibuprofen as needed.
Okay. And then pre-existing conditions.
He had back surgery 5 years ago to repair a ruptured disc. Ruptured his spleen in a car accident about 15 years ago.
Okay. And last oral intake.
He had coffee this morning, some jerky and chips about an hour ago.
Okay. And then events leading up. Obviously, you were cutting wood.
Yep, cutting and loading firewood when the pain started about 40 to 45 minutes ago.
Okay. I don't think that it's the GIGU. It's not physical skeletal. I believe it's not pulmonary. It's not skin. I believe it's cardiac issue. I want to take your vitals. And 142/98.
His blood pressure is 136/86.
All right, and his pulse.
Pulse would be 78.
And his breathing, his respirations.
Yes, 16.
16, and then his blood pressure was.
BP was 136/86.
All right. I think we're going to go ahead and keep monitoring this patient throughout transport, and once we get to the hospital or meet up with ALS, we're going to give a patient care report of a 46-year-old male with chest pains, BP 136/86, the pulse is 78, respiration is 16, his O2, SpO2 is 95%, clear lungs, complaining of chest pain, and he was cutting wood prior to this event, and he has been stable all the way to the hospital, and I believe that is it.
Okay, is there anything you'd like to add, change, or delete?
I do not believe so.